Hi, this deck of cards was compiled in order to facilitate working through the MCAT style passage, clinical vignette of persistent depressive disorder. Okay. A person with an blank locus of control believes that their life experiences are the result of his or her own actions and can be controlled. So, what type of locus of control belief system is this? That would be an internal locus of control. So, people who have an internal locus of control usually have the underlying cognition that they're in control of their own destiny. As you can see, this guy here, he's suited up, he looks very confident and very together. And these are usually the signs of someone who has an internal locus of control. Blank inhibitors inhibit chemicals that remove neurotransmitters in the body. So this is a little bit of pharmacology for you. And what type of inhibitors do this? That would be MAO inhibitors. And here we see that some MAO inhibitors might bind neurotransmitters, some might block their reuptake, some might release mimicked chemical versions of neurotransmitters. Okay. Actually, these are just two different mechanisms. Blockage of reuptake. And, like this is the injection of the MAO into the synaptic cleft. So there'll be more to come on this. You don't have to know too much detail about this. It's just good just to know this much information about it. Okay. T blank antidepressants increase the available amount of neurotransmitters in the brain. So what type of antidepressants increase the available amount of neurotransmitters in the brain? That would be tricyclic antidepressants. And here we see that the mode of action or the mechanism for this tricyclic antidepressant is to block the reuptake of the neurotransmitter, allowing it to saturate the brain tissue, okay? So somehow it would block the reuptake back through this vesicle or canal or adhesion, depending on whichever way the neurotransmitter gets re-uptaking into the synapse, the presynaptic cleft, that is. All right? So don't get too hairy about this. There'll be more to come. E blank therapy, ECT, induces brief seizures through the use of electric currents passed through the brain. So what type of therapy? ECT for short. I'm not sure if I pronounced this correct previously, but you can read. I'll give you a moment. That would be electroconvulsive therapy. Here goes a diagram of a patient undergoing this therapy. Like he's grounded to the floor. Where's the grounding? I thought that was pretty funny. Any electrical engineers or engineers out there would find this funny. although it's not, it's actually very serious. Anyway, here goes the electrodes, the voltmeter, recording devices, ECG, to make sure the patient isn't dying, that they have a normal heart rate, a mouth sedative, and an oxygen meter on their index finger to make sure that they're properly saturated. So this would be a typical setup, okay? Oh, here goes the ground to make sure that they don't get electrocuted and the electricity fed to their brains gets dissipated. Blank studies are in-depth investigations of a single person's or small group's behavior, course of disease, and treatment. So what type of study looks at one person or a small group of people, intentionally not having a large sample size? So that would be a case study, okay? And so just for your conceptual clarification, here you see a patient chart and a magnifying glass zeroing in on the patient, just highlighting, it's a single person.